Hello, dear aquarist. Welcome again to one of my cases of fish diseases. And today it's about Boraras merah, a tiny fish like a Microrasbora that was suffering from some very special big balls, growths on the body. Very nice to see for me as a fish doctor. But when you have such a fish, not happy, because nature provides sometimes these kind of weird infections. So I share you my findings about the Boraras merah with yellow grub. That's the English word for it, or encapsulated worms in the body, in the skin, in the muscular tissue. This is my case 316. Books on fish diseases? Yes, at least you should have one of them. The practical guide or the new illustrated guide that you can learn about the prevention, the diagnosis, and what medications you can use to treat your fish. And here I show you the large growths on those boraras. You can see this is not good looking, and those are encapsulated trematode worms called yellow grub. So you can take those big balls or growths out, and you can see little tiny worms. Well, little, well, they look rather big for those tiny fish. Here we see one. That's a trematode worm. It comes out of a capsule. And here we have it under the microscope. Well, it's a large worm. And probably it's the species Clinostomum. Probably. Because I'm not a proper specialist in diagnosing exactly which species it is. I know it's a Metacercaria, a larvae of a trematode, and you can see here the clinostomum, the organs. And to explain you something about that clinostomum, there is a life cycle that determines why and how do they get into the fish, because it's usually the bird who has the large worm inside. They call it flukes. Those worms release eggs, and the eggs are changing it into a Miracidia form. What's a beautiful name? They go inside the snail, and then the snail again, the larval stage from the snail goes into the fish, and then it makes those strange big growths, and then the cycle is closed and the bird eats that fish. So there needs to be a bird, there needs to be a snail, and a fish to make the cycle complete for this clinostomum. And I suspect this was the trematode affecting this Borara species. So wild fish can have such worm infections. So I explained in the life cycle. Also fish farms sometimes have it when they have poor biosecurity, no netting, and leaving the birds come to eat from the fish and having snails in the ponds. It still exists that in our industry we have these kind of terrible biosecure fish farms. And we are not able to treat because that little worm is encapsulated. There's no medication that can reach it. And some of the fish can live for a long time, as long as they're not badly damaged. And they cannot transmit this disease to other fish. These worms cannot go to other fish, except in some cases when a fish eats, as a cannibal fish who eats other fish, carnivore fish. That might be, but he usually, the Clinostomum will not survive. He usually needs a bird in this case, not another fish. You can help to improve the immunity of the fish with a functional fish food so he can maybe live for a long time with this growth when it's only one or the tiny one. Not nice to see, but when it's so big, well, it's not nice. I can recommend that you treat the health of your fish, improve the immunity with are Dr. BASSLEER, the Biofish Food Forte, a functional fish food with probiotics and prebiotics. So my books could help you to understand fish diseases and especially helping you how to treat and what dosages to use and how long to treat. But not in this case. This case, it's another way of medicating. It's not used to or helps to give medications. Fish doctoring at my Patreon can be helpful for you that wants to learn more, to become more specialized in diagnosing fishes or understanding quarantining of fish. So I hope this special case on this Boraras with big growths, with yellow grub, tells you something interesting on fish diseases. Subscribe to learn more.